improvement work, and she is our liaison, and we are so grateful to her and to Maddie Whalen as part of our committee, because they are a part of our group and they help connect us to those valuable Johns Hopkins healthcare system and Center for Nursing Inquiry resources that we're so blessed to have here at Howard County. So I'm going to let Nadine go ahead and give her presentation about forms of inquiry.
Everybody, thank you for being here today. I'm gonna see if I can get myself set up here, stand where I'm supposed to stand, not move around too much because I'm a walker. So I am introducing you today to the 3 forms of nursing inquiry. Give you a little broad overview. Let's see if I can actually, there we go. A broad overview of the 3 forms of inquiry so that you are familiar with EBP, evidence-based practice, quality improvement, and research. Know the differences between them and can identify them when you see them, or to determine which type of inquiry you want to use, depending on the question and approach that you're interested to do. So we like to think of the 3 forms of inquiry as the 3 legs of a stool that help to support our practice so that we're using the best evidence in our daily work. So I've got, the definitions up here. I'm not going to read it per se like this, just kind of give you a little bit of the highlights. The evidence-based practice is a problem-solving approach to clinical decision-making in your healthcare organization, integrating best clinical practices from the evidence, as well as the experience of the provider and the patients. Quality improvement is a process to improve healthcare services at the local level. So when you're having issues with fall rates or infection rates, we're going to target your specific area and figure out what the concerns are for that specific question. Research is a systematic investigation using qualitative, quantitative, or mixed methods approach to uncover new information about how to approach any particular problem. So we like to think of evidence-based practice as giving us what we know. We use quality improvement to apply what we know now, and we use research to uncover new information. So what we know now, evidence-based practice is what we know, quality improvement, using that information now, research, creating new information. If you think about it in terms of outcomes, like what do you get when you're done with any of these, with any approach in particular, evidence-based practice offers us the opportunity to take all of the existing up-to-date information about how to approach a problem, synthesize it, and translate it into your specific setting. Quality improvement tends to be a continuous process of maintaining your goals. You've got target goals for fall rates or infection rates or whatever your targets are. You mentioned sustainability earlier. Having a quality improvement audit process can help you to maintain your goals or see sooner than later when you're not maintaining your goals and to get back to those. And then research helps us find new knowledge when there isn't information about exactly what the question is that we're trying to ask or answer. So I'll go a little bit deeper into each type, keeping in mind that this is really a very broad overview of all of these types of inquiry. So evidence-based practice. Okay, I have a question for you before we get into this a little bit too far. 2006, 2008, what were you doing? Do you remember that far back? 15 to 17 years ago? Yeah, just had a baby. We're still in school. Okay. So those babies are now learning to drive. They're juniors or seniors in high school. We are practicing with the evidence that was current as of that moment today. It takes 15 to 17 years to get what we know into practice and daily use, which seems like a really long time. And these days it kind of is. So why we need EBP is to help to make that happen a little bit more quickly. So, yep, see, these people are now adults. With pretty much every system or approach, there are multiple different models, and we absolutely recommend using a model to kind of help you guide your way through any particular kind of project. Same is true for evidence-based practice. There are multiple models. The most familiar ones are the Johns Hopkins EBP model, the Iowa model, or the Stettler models of EBP. So whichever one you choose, they're going to help you to go through your project. We are, of course, going to discuss the Johns Hopkins evidence-based practice model today, because it was developed by and used by Hopkins nurses right here. So we like it, we're going to use it, and I'm going to share that information with you today. So has anybody seen or used this book? Lots of nods, yes. Okay, so this is your owner's manual for EBP. It has all the instructions, all of the examples, and all of the tools. These pages you can see here on the screen are what we call appendices. So there are appendices for each step of the process. And that process we kind of consider, we call it the PET process. I'm going to move these things because they're going to fall. PET, oh, I didn't know I had that. The PET process is, PET stands for practice question, evidence, and translation. So the whole 20-step process seems like a lot, but we separate it into those sections. The practice question, where you're developing your question, developing search terms for your literature review, gathering that information. Evidence is where you're going to collect that evidence, review it, find the best practices out of all of the information that you're finding that is current and up to date. And then the translation is synthesizing it, putting it all together so that you can apply it to whatever application you're going to use it in, and disseminating that information as well in publications or presentations. The model also includes these appendices. So they are tools to show you how to go through all of those 20 steps from the beginning to the end, including your stakeholders and how to write your paper discussing the project as a manuscript. Quality improvement projects, similarly, we have multiple models. So quality improvement, applying best practices now, right? We know what the best practices are because we just did our EBP project, and so we know what the current evidence is. The most commonly known and used quality improvement models are the model for improvement. Most people know it as the PDSA cycle. Lean or Six Sigma. Sometimes Lean and Six Sigma are combined, and it's called Lean Sigma because they work really well together. I'll explain a little bit about each one of those too. The Lean approach is seeking to reduce or eliminate waste, and waste comes in many forms. It can be wasting time, so the time from door to procedure, or lab result to intervention, wasting motion, so that's me walking from one end of the unit to the other, gathering the supplies, from the room to the supply closet, to the labels, to all the things that you need to do on the way to actually performing a procedure or whatever. Overproduction or inventory waste would be opening your supply closet and realizing that half of your inventory is expired. So those are the kinds of concerns that the Lean approach can help you to manage and resolve. Six Sigma, another approach to quality improvement, seeks to eliminate errors or variability. So this is best used when you are trying to do the same thing exactly the same way every single time, mostly in order to reduce any risk. So this is best applied when you're doing things like central line dressing changes, You don't want to open your supply kit and then put on your gloves. Or pick things up and then put on your gloves, you know what I mean? You want to follow the steps so that you get everything correct. Another example would be those pre-procedure checklists. You want to make sure that you've got the right patient, you've got the right location, you've got the right operation, you're doing all the right things. So those are places where Six Sigma, eliminating errors, is a really good approach to your quality improvement process. The process here has an acronym called DMAIC. It's define, measure, analyze, improve, and control. Very similar to the PDSA cycle, where you're making your plan, you're taking your data, look at what the data is that you've got, make any changes to continue your improvements, and then control. So you're doing updates and audits as time goes by to maintain those changes so that they're safe. As I said just a moment ago, Lean and Six Sigma tend to work really nicely together in healthcare. So sometimes it'll be presented as a Lean Six or Lean Six Sigma process. The quality improvement approach that we know best is used most often is the model for improvement, which most people are not aware. It actually is a two-phase process in which the first phase helps you to prepare for that PDSA cycle part. So phase one is where we are setting our aims, establishing the measures, and selecting the interventions. So your aims, what is it that you want to do? Your measures, what data is going to help us know what we have done that shows us a change and improvement, and the interventions, what are we going to do to make those changes happen, to make that improvement occur. And then that actual plan, do, study, act process. So plan where, when, for how long, on what setting you're going to do your improvement work. Go ahead and do it. Start, you've got your baseline information, start your intervention, do your intervention for a certain amount of time. As you're collecting data, take a study moment, see what you've gotten from your results, act on what you've seen. Have improvements been made? If they haven't, maybe we need to start a new cycle with a different intervention. If improvements have been made, you can either decide to maintain that or introduce a new cycle, in which case you may end up doing multiple PDSA cycles, so that you're building on the improvements that you have gained through each cycle. So it's not usually just a single cycle event. An event or recognizing that you have a quality improvement need may start you on a quality improvement project, but you definitely want to bake in some kind of maintenance, re-auditing, making sure that you're maintaining your goals. In which case, if you find that you're slipping from your goals, you can just re-implement some of those cycles that you knew worked before. For research, we're generating something new. So maybe we did an evidence-based practice literature search and we really didn't find much information about the question that we're asking. We would apply quality improvement processes, except that we don't actually know what it is that we need to do to improve this particular situation. So we do a research project so that we can generate new information about how to address this problem that we're having, or this question that we have. Typically, research projects use qualitative, quantitative, or mixed methods approaches. Quantitative research is what we're typically familiar with, uses data, numbers, counts. You might be looking at documentation adherence. So what percentage of nurses documented pre and post pain scores? Maybe they asked, but they didn't document it. So we're talking about numbers, right? Qualitative research has more to do with the experience, lived experience, or feelings things like that. So we might want to know from nurses their experience of living through being a nurse during the COVID pandemic. What was it like when things like that changed? And mixed methods approach, just like it sounds, it combines both approaches. So you have both qualitative and quantitative together. Questions about any of that so far? You have a burning question you want to ask? Like, are you thinking about all the ways that you can apply these different models, different approaches? Okay, good. So what do we do? What do we do now? Or do we create new information with the question that we have? So I'm actually gonna kind of talk through this a little bit more as a way to think about inquiry altogether. We think about EBP as the jumping off point, or your diving board, as the case may be, into your inquiry. You need to know what literature and evidence exists so that you don't go to do a quality improvement project with outdated approaches, outdated practices. And if there isn't information, you can do a research project, like I mentioned. So we'll go through kind of a scenario using falls as our example. So you're doing an EBP. So let me start over. You have found that, on your unit, you've recently experienced a 35% increase in falls. That's not good. We need to fix that. Do we know how to fix that? What are best practices for reducing falls on the unit? So we go to the literature and take a look to see what are best practices for reducing falls. We found that okay, so you can ask the question in kind of two different ways. You can ask what's considered a background question in evidence-based practice, and that would be all of the existing evidence. What are best practices for reducing falls? Or you could use it like a comparison question, and that would be a foreground approach, in which you could say, in adult inpatient oncology, do non-slip socks reduce the number of falls with injury as compared to bed alarms? So bed alarms and non-slip socks are two completely different kinds of approaches, but they both reduce falls. So we decided that we are going to use non-slip socks. So this is our quality improvement. We're implementing the best practice of the non-slip socks. How do we make sure that everybody is using them? Do we need to make sure that they are in the room? Do we need to make sure that the nurses understand the importance of using non-slip socks? Do we need to put it in documentation? So these are features of a quality improvement project that you might want to follow to make sure that everybody has the socks on. And one of the outcome measures is also going to be a change in your falls rate, right? So we did that. And we've made some improvements, but it's not as good as we'd like it to be. So we've applied all of the best practices that we know how to apply, but we're wondering if maybe we add non-slip gloves or use non-slip gloves instead of non-slip socks. Would that change our fall rate or improve it in any way? So we do a research project. And the question for the research project would be, do non-slip gloves improve fall rates compared with non-slip socks? So there is your research question with the non-slip socks and the non-slip gloves. Ta-da! So questions about different types of inquiry, the way that the question is asked, or the thing that you need to do to get to your answer? Okay. Has anybody done quality improvement projects? Yeah, Nancy, you don't have. We know Nancy's done a quality improvement. So can you give me an example of a quality improvement project that you've done? I know a few that have happened here.
We actually did one on MCU about falls,
Okay.
and we had education that we rolled out to the staff on getting two people to assist the first time mom up to the bathroom, because we noticed research that the fall was happening in the bathroom. We also put on a little sign to tell mom to not get up on her own.
Okay.
She thinks she's capable, but the anesthesia could still be kind of making her legs a little numb, and then making sure that we educate the mom.
Right.
Call them.
Call don't fall, yeah, so just for the virtual audience, I'm gonna relay that a little bit. So they did a falls reduction quality improvement project. And they utilized signs so that moms would call, not fall. Had 2 people help the mom the first time out of bed. And something else.
Just educating the mom and the staff.
The mom and the
to do
staff.
these processes.
Right,
And then there's also another process where the nurse would do like a whole complete assessment to make sure that mom's capable of getting up on her own the first time, so that she didn't, have her knees buckle or
right.
something.
Make
So-
sure to do that assessment before mom gets out of bed the first time. Excellent, good. So I'm gonna now ask for a little bit of interaction. I'm gonna quiz you with a couple of scenarios so that you can tell me if you think this is EVP, quality improvement, or research. And I'm only gonna give you one of each because I'm running out of time. So here we go. Nurse Wes is working to ensure the nurses on the unit are correctly documenting fall screenings. They think it might be a good idea to start sending the nurses a report card each month with their individualized documentation compliance scores. They know it's easy to pull the data from the electronic health record, but they aren't sure if there's any evidence this works to improve charting. This is an example of what kind of inquiry. It's EBP. Yeah, because we're looking for best practices. We don't know what it is, so we're looking to find out what information is that we are going to use. I'm going to skip this one. That's also EVP. You guys know this one. Nurse Kaya is on a work group to increase compliance with the best practice of skin-to-skin contact for newborn babies and their moms. They've been doing audits and performing staff education to monitor progress. This is an example of quality improvement. Yay, woohoo. Okay, I'm going to skip that one. Also quality improvement. Nurse Riley has been taking care of patients with COVID-19 and is curious what the effect of wearing PPE is on nurses' ability to stay hydrated during their shift. Because COVID-19 is so new, there's really very little existing information about this problem. So this would be an example of research, yay. And I actually did that twice, so no new news there. This was a really basic, broad overview of the 3 forms of inquiry. 20 minutes doesn't give me a whole lot of time to really get deeply into these different forms, but we do have all kinds of opportunities for you to learn more, engage with us, and participate in your inquiry questions and projects. The Center for Nursing Inquiry has a number of live and recorded events. We've got education on our website, the Center for Nursing Inquiry website. You have your local nurse inquiry committee team here. So please utilize those. Rachel and Vicki lead that. So you're welcome to join the inquiry group here. And also please stay in touch. We've got a number of social media ways to reach out and keep in touch with you. And I was wondering if you have any questions.
So Nadine, if
Yes.
somebody wanted to get a copy of the Johns Hopkins book to help them with a project, how do they get a
How
copy?
do you get the book? That's a really good question. Email us at the Center for Nursing Inquiry. You should also be able to reach out to Vicki or Rachel so that they can connect you with a book as well.
Awesome. Thank
Yes.
you.
Yeah. I did want to mention, actually, if you are using the EVP book or in the process, all of the appendices that are published in the book are also available online through our website. And I would encourage people to use them from the website because we're making improvements and changes and, you know, in the process of putting out a new edition all the time. So you're most likely to get the most up-to-date version of any particular tool from our website.
Oh, that's good to know.
Yeah.
Thank you.
Anything else? All right, thank you very much. Go do good research and free projects.
We were gonna do